this is the half exam for a shorter version of the shoulder branching exam. Go.
Okay. All right, so we're going to make sure we're properly exposed. We're going to inspect the anterior side, looking for swelling, deformities, scars, any muscle atrophy, and any discoloration. Move to the posterior. I'm going to be looking at the scapulus for any high or winging of the scapulus. Looking at the cervical area for kyphosis and scoliosis. Okay, and then looking at the upper back for any scoliosis, kyphosis, and looking at the symmetry. Okay, and we're going to palpate here. We're going to do this just one side, but we want to make sure we do bilaterally. So the sternoclavicular joint, right here across the clavicle, feeling the coracoid. Okay, and at the end of the clavicle, the AC joint. Okay, and then the acromion. Good. Okay, and I'm going to move your arm back here and extend the elbow or the shoulder. Rotator cuff. Good. And then the bicep tendon. Move it back and forth, be able to find it. There we go. Good. Okay, now the back, we're going to feel the spinous processes. Start up top at C1, go all the way down to C7, maybe a little bit past. Okay, and then feel the trapezius. Good. Supraspinatus. Good. Coming down the angle of the scapulus, right there. And then we're going to feel the rhomboids all the way up. Good.
Range of motion, C-spine.
Okay, I'm going to have you touch your chin to your chest. Okay, and then look up in the air and go that side, over that side. Or touch your ear and do the other ear. Good. Okay, now your arms. I'm going to go up in the air and try to touch your, like that. Good. Bring them on down. Okay, and go up in front of you like that. And then back behind you as far as you can. Good. And now I want you to take when you try to touch shoulder blade. Same with the other side. Okay, and then up underneath, try to touch your shoulder blade. And same on that side. Good.
All right, passive.
Okay. Start with flexion here. Flexion. Extension. Abduction. Adduction.
Mm-hmm.
Any internal rotation, external rotation. Good. Now we're going to do this against resistance. So with your shoulders, I'm going to try to, when you stick your arms out like that, try to push up against my arms here. Good. Pull. Good. And then try to lift your arm in, pull it in. Good. Push out with your hand here and in.
Internal and external rotation.
Okay. And we're going to do that bilaterally.
Elbows.
And then pull against my hands. Good. And push against my hands. Good.
Wrist.
Okay. Arms like that. And just try to rotate your hands down for flexion. And then extend them.
Good.
Good.
Fingers.
Fingers out like that. Okay. I'm going to try to push these in. Good.
Sensory, sharp, dull.
Okay. Let me know if this is sharp or dull. That's going to be dull, and that's sharp. Okay. That's sharp.
Yep.
Okay, sharp or dull. Eyes closed.
Deltoid.
Thumb. Can you go
Thumb,
to
dorsal
sharp?
aspect.
Sharp.
Middle finger, palmar aspect.
Dull.
Little finger, palmar aspect. So middle and little, and then the arm.
Okay, now we're going to do that bilaterally, so we're going to go from side to side.
All right, DTRs.
All right. Okay.
Good. Special techniques.
Okay, we're going to do the compression test. Make sure you're sitting straight up. And we're going to push. Acromion clavicular stress test. Cross the shoulder here, and then we're just going to passively. Cross there. Good.
Near test.
Which one is that?
Near test.
Near.
Yeah.
Passive up.
Oh, okay, that's right. Good. Okay. And
Empty can.
Hawkins.
Hawkins.
Okay, good. And then this one, have you the arc test. So have you just all the way up with your palm out, up into the air as far as high as you can go. Good. Okay. And
Rotator cuff, drop arm test.
I guess I'm going to just drop this, go ahead and just relax, and let it lower slowly.
Okay.
And then with both arms up in the air,
Resistance.
like this, and we're going to push down on both sides.
Good.
And
Biceps tendonitis. Supination.
okay. Supinate and pronate the hand, and then try to do that same motion again. Good. And
Speeds test.
ease test out like that. And bilateral is going to push down.
Good.
Okay.
Apprehension.
Apprehension, prison test. just gonna, as we pull back, I'm gonna push with my hand there. And then if all these are negative, we're gonna do C-spine, cardiac, and respiratory and GI exam.
Perfect.